The focus of my research over the last decade has been primarily around treatment-related outcomes for patients with gynecological cancers, really focusing on the treatment of patients who are underserved, so essentially women that are of ethnic or racial minorities in this country, or women at the extreme of ages, very young, or the elderly. Demographics of this country are changing over time, and we are more and more becoming a country of underrepresented minorities, are becoming more a majority in the population. And one of the concerns that I have is that as we change in terms of the demographics of this country, and we also have a lot of innovation in cancer delivery, especially in the cancer space, there's been a lot of innovation both in surgical treatment and the medical management of patients. And to the degree that we don't understand how we are leaving vulnerable populations behind, the disparity gap actually gets wider. We put together a protocol to enhance recovery after surgery for our patients. And our previous understanding of where we have gaps in the care that we deliver allowed us to inform those protocols before we actually rolled them out, so that we had in place initiatives that would be able to support vulnerable populations as we were trying to roll out these efforts, understanding that we needed to have, for example, documentation that was accessible to our patients who are not English primarily speaking, access to initiatives that would allow patients to adhere to the protocols based on what supports they have at home, and taking care of them in the hospital in a way that actually translated what we wanted to do and carry forward in improving their outcomes from surgery with support that was attentive to their cultural differences. I think that we're already seeing how understanding where we are informs the future of how we roll out these services and these protocols to be more inclusive. Cervical cancer is the one cancer that I treat that is entirely preventable. We now have vaccines against human papillomavirus that are primarily preventive of this cancer, and we also have screening programs, primarily the pap smear programs, that provide secondary prevention. And what we see is that the patients that are being diagnosed with cervical cancer are women of underrepresented minorities that have not had access to either vaccination programs or to screening. The cost of care is incredibly challenging to the system, because instead of preventing a cancer, now you're dealing with a cancer that is locally advanced or advanced, and providing care for that patient actually is more cost burdensome to the system. So ultimately it matters, because it shouldn't make a difference to us whether you're Caucasian or African American or Hispanic. It shouldn't matter how well you do when you have a cancer diagnosis. What we're finding is that location of where you live, so geography and ethnicity, drive, after you control for everything, will drive how well you do after a cancer treatment. When you find through research that outcomes are less favorable for a certain pocket of the population, I think it is in our mission statement to find ways to remedy that gap and actually provide access that is equitable across the board.